We started on this path a little over 2 years ago. The idea being that when the new jail construction project was completed, that we would have a place for inmates who were not doing well in the facility due to various mental illnesses. And this is what's the culmination of this project is to form take what we had already done, which is having a competency restoration unit inside the jail, getting folks who are suffering with mental illness and not able to participate in their own defense, getting those folks the assistance they needed so that they could be matriculated through the criminal justice system and either put in the state hospital or move on to state prison, but get them out of our jail so that they're not using our resources here, and they're getting the proper care that they actually need. And so this is a real game changer for us. This is the next step. This allows us to broaden those services inside the jail through our partnership with Southwestern Behavioral Health and ensure that inmates who are in this facility are being treated humanely, and that we're not just putting folks who have mental illness and putting them in a concrete box and then miraculously expecting their conditions to improve. So this is a humane thing to do. It's efficient for the taxpayer, and it's the right thing to do for our local criminal justice system. And it was made possible by funding from the Vanderburgh County Council and through the support of the Vanderburgh County Commissioners. Now I have with me here Commissioner Amy Canterbury, who signed our agreement with Southwest Behavioral Health yesterday at the Commissioners meeting. And I have also with me former Commissioner Cheryl Musgrave, who was instrumental in ensuring that we got the opioid settlement funding necessary to partially fund this program and our future efforts in the jail as well to combat mental illness and substance abuse. And so I'd like to turn it over to Ms. Katie Adams, who's the director at Southwest Behavioral Health.
Hi, welcome everybody. I want to thank the sheriff and his team. We started this relationship when you started, and really we started before then with your predecessor. But this idea of helping our community wherever they are to help them experience recovery, and that's what Southwestern is all about, is providing the care that people need wherever they are when they need it. And this started a few years ago also with our mobile crisis team. We have this great relationship with law enforcement and helping individuals in the community to prevent them from getting into the jail. In a year we do over 1,000 mobile crisis runs and only 3% end up in jail. So it's a huge, great preventative piece. Now we're moving into the treatment piece to take care of individuals who did commit a crime but are in jail and need our help. And that's what we're here for as a community mental health center, to treat those who need us the most. And so it's a great place to be in Southwestern Indiana with the support of our commissioners, the support of our law enforcement. We have a wonderful team behind us that are very passionate and committed to serving these individuals. And like you said, it's a very exciting game changer. And we are like no other place in the state of Indiana. I will just say that. The collaboration that happens here between healthcare providers, law enforcement, we're completely different cultures, do completely different things, but we've learned how to come together for this common good and this common goal. And that is very unique about where we live. So I'm very appreciative of Sheriff Robinson, very appreciative of the commissioners who see this, see the vision, see how important this is. And thankful for this team that's behind us, that are the boots on the ground. They're the ones that do this every day. So we're open to questions about this great initiative that we're getting started today.
Thank you.
Yeah. Yeah, so with us here from Southwestern, this is Sedalia Ellis. She is the director of our community support services, which includes our forensic program. And so our forensic program is growing. So it started with just some initial outreach in the jail, moved into the Indiana's very first jail competency restoration program, very first in Indiana, that is hugely successful under her leadership, and now expanding into the treatment that we're providing in jail. We also have Dr. Unfried, who's back there, who should be standing up here. He's our psychiatrist, who is kind of the brainchild of a lot of things that we do here in the jail. But he is overseeing the psychiatric treatment of individuals, so he is right here. And then behind me we have our jail-based and assertive community treatment team, Dan Haviza, Danielle, I think our new people's names, Catherine, and yes, and so we also have a peer support professional that's going to be a part of this program, which is huge. So, so thankful for the Southwestern team and their passion and commitment to what we do. And you have people to introduce.
We've got some people here as well. My jail commander who's behind me here, Dave Getling, who's going to be a big part of administrating the program and be the go-between between our staff and Southwest Behavioral Health. His staff is here with him as well in green. I got the Chief Deputy over here, Nathan Sugarman, who helped negotiate the contract, and then our Commander of Patrol, Matt Korn, and our Community Engagement Lieutenant Chris Rowe are here as well. I would love if you guys have questions about how the program is going to work. Sedalia is here to answer those questions as we are as well. So fire away.
Can you speak more about how the program itself will actually work?
Absolutely. So while we're waiting, right now we're in the jail is in the construction process of the unit, but we will not wait to provide services. So we'll start out with a soft role, which will include our peer support specialist, will also include case management, as well as our psychiatrist doing some medication consultations, seeing these individuals in the jail, and then recommending the medications that are appropriate for them. We will also prioritize our incompetent to stand trial individuals that come through to our services. And so our hope is to restore their competency while they're in jail. That way they're given a fair right to their trial, and making sure that we wrap services around them as far as psychiatry, therapy. We do have a forensic therapist that will be coming on board, as well as case management and peer recovery.
And can you clarify, did you say this will be specifically for individuals who are deemed incompetent, or will there be others as well who benefit from the program?
So there will be a mixture, but we know that the individuals who are coming through our incompetency to stand trial program, we will prioritize those individuals on that unit, but we will also see individuals that the jail has recommended that need mental health services, that require a more therapeutic, calming environment, because we know that people who are taking psychotropic medications, it can be very sedating, and so sometimes being in a jail setting, general population with sedating medications, it may be difficult to get the rest that you need to also flow into the recovery process. So opening up that space for those individuals by giving them that therapeutic environment while wrapping services around them helps with their overall recovery. So in theory, we will accept anyone that the jail has informed us about, but we also will make sure that we prioritize those individuals who we are trying to reduce the chances of them going to the state hospital by restoring their competency in jail and wrapping those services around them.
And whoever needs to speak, give us a chance to adjust our talk before you talk. But my question is, there's an added layer of complexity, when you have people who are dealing with mental health issues and an already kind of troubled, so often criminal situation. Can you speak about how these kinds of partnerships between the two entities kind of get in there and start smoothing things out for everybody?
I'll say a couple words about that.
Thank you.
As Katie, and I wanted to call attention to Commissioner Mike Gable, who just walked in the room here. Not only was he instrumental in getting us the opioid dollars, along with Commissioner Musgrave, to help pay for this program, but he was instrumental in his role on both the council for helping to fund our program as well. So he's done double duty. So we could not make these programs work if it weren't for our very forward-thinking commission and council. I could not do my job without these folks. That just wouldn't succeed. So I'm looking forward to that again. But you're right, as Katie had alluded to earlier. It's such an unusual set of circumstances that we're used to, and our ingrained culture in this facility for its entire existence has been we put people in boxes, right? And we try to do it as safely and humanely as possible. But if you keep doing the same thing over and over again, you can't expect, at least logically, expect different results. And so this movement towards rehabilitation, this is what allows us to move that direction, having folks like Southwest Behavioral Health. And it is a changed mindset, so it's just not something we're used to doing. And we've taken baby steps, and this is that final last step that we think will lead to bigger and greater things as we expand this mental health unit. So it is truly a partnership with our jail staff becoming comfortable with having therapists and peer support individuals, and we will expand that program later on this year as well. As we expand these folks in the jail, we're going to be seeing a lot of folks walking around who aren't wearing uniforms, and that's a good thing. It And that takes a mindset shift in our staff because they're used to seeing folks who are guards. But we want our inmates not seeing just guards, but we want them, those who are willing to change and are able to change, we want them to have every avenue possible because we know that if you just send somebody out the front door and have made no effort to rehabilitate them, then they're going to walk right out the door and go right back in that same pattern. So this is about breaking that cycle of recidivism. And I will use every avenue possible to do that because it lowers crime. And at the end of the day, this is about public safety. It's the humane thing to do, and it's the right thing to do, but it's also the right thing to do to improve public safety. And that's my job, and I'll do everything I can to do that. And this is part of that.
And if I can also share, just to kind of speak to our relationship, as far as the culture change, this is nothing new to us. When we started the development of our jail-based restoration program, that was the start of that culture shift. So we're learning from each other. We're learning from the staff at the jail, as well as the staff learning from us to create a more therapeutic environment. And so it's pretty cool to watch that transformation happen in real time.
Sheriff, could you talk a little bit more about just the background on, the motivation and onus to get this program started? I know that you'd mentioned that this stretched back all the way to the previous sheriff. So I don't know if you could talk a little bit about the backstory and how you got this ball rolling into where you are now.
So as Katie had alluded to earlier, we were the first in the state here at the Sheriff's Office around about 4 years ago, maybe 5, to begin what was called a competency restoration program. And what that program did was, first of all, we had a need, which was we noticed that a lot of folks were in the facility that were awaiting a bed at the state hospital, but they were so decompensated that they were unable to participate in their own defense. And so a judge would order someone's competency to be evaluated, and with the hope that they could get them into a state hospital bed at some point. And so because of the lack of bed space and capacity at the state hospital, these folks would just kind of languish here at the jail in no man's land, in this kind of purgatory. And it was, number one, it was increasing the jail population. And number two, it was increasing the jail population with the worst possible candidate to be in the jail, somebody who's mentally ill and can't even participate in their own defense. So if they're not moving their case forward, why are they here? I mean, this was a bad fit for everybody concerned. And so Southwest Behavioral Health and our friends at the Family and Social Services Administration with the state and our own local state hospital came up with this plan to have a competency restoration program in the jail. So bringing in psychiatrists to the facility and treating the inmate in place while they're in the jail, helping to restore the competency of that individual so they can get their court case adjudicated and then move them on to other things, whether it's in the state hospital or prison or release. But to stop this process of which someone just sits in the jail with no forward movement on their case. So the idea of this next step is to take the successes of that and not only benefit to an even higher degree those folks who need to have their competency restored, but also benefit folks who are just maybe not acutely mentally ill, but are suffering from mental illness and it's impairing their life chances. And so I would rather send somebody out the front door properly medicated and on a pathway towards making their future doctor's appointments and staying on the medications they need so they can become employable. Otherwise, we're just sending them out the front door with a bus token, and then we can't be surprised when predictable results occur, which is they come back to jail and they commit a new offense because they're dysregulated. You guys have more to add about that?
I can add to that. The other benefit of this early intervention and providing treatment in jail is that people get better quicker if you intervene earlier, right? If you are sitting sick for a long period of time, it might take longer for you to get better. So the fact that we can do this early intervention and also build this relationship with individuals where they already know us, so when they leave the jail, they're already connected to us. We are going to see them the day they leave, the next day, the next day. And so they already have their treatment team. And so their ability to stay engaged in treatment and recover, those chances are much, much higher.
Any other questions?
Well, just real quick follow-up on that. Is there any angle to, you mentioned people's court cases kind of languishing as they might be waiting for a state hospital bed, then they get sent there, and then they have to come back, there's hearings, reports. Have you had any discussions with the courts about, is there any thinking that this could further help, speed along slowed, cases that are slowed down as people are struggling with competency or, mental health complicating their defense?
Yeah, at any time, at any given time, we have between 1 and as many as 8 individuals who are undergoing court-ordered competency restoration. Even more than that, we have a much higher degree of individuals who have simply are having that initial evaluation performed. So you've got individuals that are kind of in the queue, having their competency evaluated. Then you have folks that are in the program itself that are having the work done to improve their competency or restore their competency. And so it's a two-stage process. So that's the idea behind this, is to identify any individual who is stalled out in court. The judges are all aware, are all behind this, and are eager to use this program to do this jail-based restoration. So the first step is identifying individuals who could potentially be incompetent, ordering the evaluation, and having that done in a timely manner. And that process is dramatically sped up under this program. And then, of course, doing the in-place competency restoration that takes place while they're still in jail, no longer having to wait for a state hospital bed. So a two-part process that this will add further capacity to that, and as you allude to, allow us to draw in other individuals who maybe are not incompetent, but still in need of mental health care in this jail.
And in some instances, with some of the cases, of course, it's case by case, but while they're going through this process of us restoring competency, they're also moving through their time. So in some cases, time is served at the end of once the completion of the competency is done, and they're able to stand to a fair trial. And then it just depends, and it's case by case. But that's the really good thing, is that it doesn't stop while they're in this program, but it's helping them along with the hopes of once time is served, they'll come into our services and they'll continue on.
Any other questions? Okay. Well, I want to thank you guys for coming out here. Again, I want to thank the commissioners and council, both past and present, for making this possible. And thank Katie and her team for being such a good partner. And look forward for many more good things to come. This is one of several programs that we're going to be rolling out the remainder of the year, and some of which will involve Southwest Behavioral Health. Further, more announcements at this time. But 2025 is a big year for us. It's when we finally see the fruits of our labor and roll out these programs that I believe will have a lasting impact on crime in Vanderburgh County and the jail population as a whole. So thanks for being here.
Thank you.